Welcome to a BW Wellbeing World of BW Business Word Dialogue on the occasion of National Doctors Day. The theme for National Doctors Day this year is Behind the Mask, Caring for Caregivers. This theme emphasizes the importance of acknowledging and supporting the well being of doctors, recognizing that they too need care and support in their demanding roles. Today, we have two very special guests with us who are extremely experienced and esteemed doctors. We have with us Dr. Ashok Kumar Vaid, Chairman Medanta Cancer Institute. Dr. Vaid is a Padma Shri awardee and Chairman of Medical Oncology, Hematology, and Stem Cell Transplant at Medanta Cancer Institute, Gurugram. With over 41 years of clinical experience, he is credited with establishing one of North India's largest private stem cell transplant programs. His expertise spans cancer genomics, precision oncotherapies, immunotherapy, dendritic cell therapy, and stem cell transplantation. We also have with us joining shortly Dr. Atampreet Singh, Director and Head of Neurology, Sharda Care Health City. With over 2 decades of experience, Dr. Atampreet Singh is a renowned expert in adult and pediatric neurology. He has pioneered epilepsy care by setting up specialized clinics, video EEG units, and surgery programs with a 70% seizure freedom rate. His work has benefited over 5,000 epilepsy patients and brought advanced neurocare to undeserved regions. A very welcome to both of them. My first question is to Dr. Vaid. Dr. Vaid, sir, over the past few decades, how have you seen the role of doctors evolve beyond just treating illnesses?
Thank you, Kavi, for that kind invitation and the kind introduction. It's an honor and a privilege to be on this program and talking about the role of doctors, the transformation which has happened over the decades. Definitely, there is a huge transformation. There was a time 50 years ago, a doctor was perceived as a mentor. And this was a more of a physician-centric approach where whatever the doctor said was the final word. And indeed, there has been a transformative change. The doctors have now moved from being the mentors to being participative in their approach in the clinics. And they have become not only the participative approach, but they have become the researchers, educators, mentors, and then they are wearing many hats today. And that's the way now doctors are talking more about, apart from only being the healers. That was the typical designation which was given to the doctors. Now doctors have become educators and communicators. They're talking about holistic approaches. They are talking about preventive, why the disease should happen. It should be prevented. They're talking of screening. They're talking of many ways by which health can be advanced. And they are also on the forefront of, especially in cancer treatment, delivering the standard of care, bringing the multidisciplinary treatments, and doing a diligent follow-up, and also being the psychosocial support to their patients and the families. I think it's a transformative role which has happened over the last few decades.
Thank you, sir. That was very insightful. Welcome, Dr. Singh.
Good evening, sir. Good evening, Kavi.
Good evening, Dr. Singh. I have already given your introduction, so I'll jump right into the question for you. How has the doctor-patient relationship changed over the years? Like, has technology brought us closer or pushed us apart?
See, when I think sir is much senior to me, he must have seen the real medicine days, what practice was there in the last maybe around 30, 40 years back. I joined medical school in 91. And I did from a very small medical college. So in that, we had a very good interaction with the patient as such. And there they used to think, oh, he's a godlike figure who can save us from, he's our savior, that sort of image. Gradually in the last 20 years or so, once this technology has taken over, I think our lives, I should say, put it that way. So anything you say, the patient will immediately Google it, and what you're saying is right or not. He'll actually confirm it, reconfirm it again and again. And he might ask the questions what Google is asking you, what are the treatment options you have and all. So sometimes we find at crossroads, okay, what to answer to him so that we are not wrong on in terms of Google. So that has changed a bit. I think their faith is still there on the doctors, but sometimes that faith gets shaken when they find some other treatment options in Google, or somebody else is doing something better than us. Then they doubt our, uh, I should say, skill or knowledge. Ki nahi yaar, not sab, they are doing better than you and all. So that has changed a bit. Faith is still there. For them, we are the saviors. There is no doubt in that. And the relation earlier it was, I should say, more of uh, professional with the patient, personal was less. Now it has turned a slightly more personal relation also. They want to connect one to one with you. So I think sir must be having teachers who are very stern, and they will not talk to patients and all. I think he can, I think, put in that hind in his hindsight, say, okay, I had teachers who are very strict and they will not speak much to patient. But nowadays it is opposite. We have to talk to the patient, win his confidence, get into his forum. Okay, we are with you. Just as he was saying, sir was saying, we become part of them in their
Yes.
decision making. Tell them these are the options you have, you choose. And then we also want the patient to participate in our decision so that litigations are also less. We have already explained this. This can happen with this. So you tell us what is the best. These are the options. All are equally effective. And this you want, which you want, you please tell us. So that has changed a bit. The patients are more informative, participative. We are also leaning on them. Okay, if anything, patient, okay, these are the options here. Tell me. So it's actually sort of keeping head on one's each other's shoulders. Okay, this is the option you have. You tell me, and this is it. So I think it has changed. Te- Technology to some extent has brought us closer, but sometimes litigations have increased, complaints have increased. Sometimes unhappiness is also there from the patient side. Okay, doctor, sir, we are not satisfied. The reviews sometimes actually take gives us a negative feeling. Okay, we are not up to the mark. So I don't know. I think it is 50-50, I should say.
Yes,
What
sir.
is sir's opinion? I don't know.
Yeah, I
Dr.
think
Vaid, your
you
opinion,
have,
sir?
yeah, Dr. Singh, you have really articulated it well. And there are two facets to it. As you very rightly said, that doctor was the sole authority at one point in time, and the patient was had a passive role in that, and patient was only listening. This was till about the late 90s, and we have seen, indeed, we have seen those days. And our professors, our teachers, they were very stern, and they were really serious in their serious roles. They were doing a great job at that point in time
Yeah.
because technology, the limitations of medicine were much more acute in that era. And since now there is a more knowledge, more options, treatments have expanded, but the personal touch, the it has taken us apart. The personal
Yeah.
touch is somewhere gone. There is at times a personal impersonal interaction, and there is an information overload as well, as you very rightly said, and then there is a misinformation overload also.
Both. It is
Now,
either.
that is actually proving the straining the relations also. Now, if you look at the online tools, there are at least about half a dozen tools today. A patient can just Google as a cancer specialist, he can just say cancer breast stage 2 treatment options and then
Yes.
come this morning with. But then patients just forget the point that there is a personal individual decision making, which is the most important at that point in time. We are not talking of a general scenario. And Dr. Google also needs to be balanced, as you very rightly said. And also, it has brought us closer also in the sense that there is more discussion, there is more empowerment, there is more transparency. We are using electronic means, which are lending more transparency. My patient actually gets the report sometimes faster than me because he has an app which is downloaded. He gets the report sitting at home, and he knows it before even I get to know. So there is a transformative role, and Also, the digital media has brought in a lot of educational resources also. Now, the key question is how the patient uses it, how the family uses it. And as I said, overload of the information and misinformation also. Lot of information on the digital platform is not vetted. Now, so there is a problem how one uses it. So one has to, and what we do in the clinic, we give them a list of the websites. Please go to these websites. These are credible websites. And then don't go to 1,20,000 search options, which would emerge out of that in a fraction of a second. Of course, the other facet is that the telemedicine, telehealth, that has brought in a lot of transformation, and then one can really do a lot of stuff together with the patient. And of course, the one of the limits which I have at this point of my career, because with the experience behind me, I try my endeavor to be evidence-based and bring in my experience at times. There are clinical situations. We always say we know the tip of the iceberg. The iceberg is still not known to medical science. So medical science is changing. So experience holds a point in every decision making. Probably the digital platform, somebody does a Dr. Google, comes to me, then my experience is actually irrelevant at that point in time. That is a limit. Patients have to confide. Ultimately, as Dr. Singh said, that it's a relationship of trust actually. And if that trust doesn't exist, then the decision making actually becomes a little bit of a question mark there.
Thank you so much, sir. Dr. Ved, I wanted to ask you this also. Like, India still struggles with a low doctor to patient ratio. So, in your experience, how does this shortage affect quality of care and even doctor burnout?
As a medical graduate, I started my journey from a dispensary on the top of a hill, and this was a 15 by 20 feet room, which would leak with every rainfall. And there was a challenge. Those were the good old days. But still, that gap, though there are a lot of government programs, the Ayushman infra programs, the National Health Mission, all these things, they are trying to bridge the manpower as in the infra gaps which are there. But still, we are short of doctors as a nation, as a overall, and not only doctors, specialized and super specialized as well. With now the economic prosperity coming in, there are more seekers with more insurance cover which is coming in, and then more health providers. Till about the mid-90s, the most of the healthcare was delivered by the government. And post the mid-90s, the many new private players came in and expanded the scope of healthcare in terms of bringing in more specialization, more sub-specialization. You just narrated his CV, and he specializes in epilepsy, and then in kids. Look at the number of lives he would have touched in his career of kids, their families. It's not, you don't only treat a patient. In chronic diseases, as he deals and I deal with, we don't only treat the patient, you treat the family, you treat them over a long period of time. There is a continuum of care, there is a continuing care. And therefore, and there are niche areas, there are selective areas in the subspecialties. So there is a overall numbers, the quality, the infra still is lacking, but there is a serious intent on the part of the government, as we can see the schemes being rolled out, and then India is getting better. I don't think we need to be very pessimistic about it or despondent about it, and then it's getting better.
Thank you, sir. That's a very positive answer and very positive approach. I completely agree. India is getting better. And Dr. Singh, just wanted to ask you that with so many expectations placed on doctors, how have you personally coped with mental health pressures? I mean, do you think we talk enough about doctor wellness?
Yeah, that is a very important subject actually. We usually are, uh, everybody's stressed out, not me actually. Everybody's stressed out in terms of profession. But uh, see, you have to find solace in someone when you go home. You have a family, okay? You can talk. Me and my wife mostly discuss out and we just relieve our pressure. Okay, it is okay, discussed out. But I think as doctors, at a certain point of time, you feel bad for the patient. First thing, that creates a lot of stress. Okay, we are not able to help him out as sir is into oncology. Sometimes patient comes at a stage 4 and he is the whole sole breadwinner of the family, he is the only earning member. So that pressure actually creates, yeah, could have done something, but I am helpless. One is this: when you are helpless, you can't help it. That creates a lot of stress in your mind. Second is, I think we need to talk to the patient and the family clear and clear. You should be clear, okay? This is the disease you're having, this is the outcomes you can have. That actually relieves you a lot, releases a lot of pressure from you. I have explained to you, these are the outcomes you will have in next 5 to 10 years. As oncologist, I think we see a lot of neurological, sometimes we see brain tumors also. A patient comes with GBM, the outcome is bad. I mean, only 50% will survive at 1 year. So we tell, okay, this is the outcome you will have. And this is the only thing which we can do for you. We can remove it, and then we can just do a radio and chemo for you. We don't know after 1 year whether you will be there or not, but this is the outcome you're going to have. He actually then is mentally prepared, he's ready. So you have done your job, okay. I have explained to him. That creates, okay, I have told my job is over. My job as a healer, I have told him the outcome. But if you ask me at a personal touch, that is bad for the patient. If someone from my family has this, I'll be at the receiving end. So that creates a lot of pressure and stress on me. Third is the number of hours what we put.
Yes,
Like uh, I think Sir must have spent around 15 years before he started his practice. I think I
Indeed, indeed.
years.
Absolutely. Absolutely.
So,
You are spot on.
so yeah, so from the age of 18 till the age of 32, 33, we are continuously working day in and out. That sometimes creates a burnout in your body, brain, everywhere. Okay,
yes,
I'm stressed out. I need a break. But that break usually will be very short lived. Okay, a week, 10 days, 15 days. But again, you have to go back to that level. So, previous question you told patients are pretty high,
yes,
doctors are less. So that is one of the main reasons for our burnout.
yes,
If you see abroad, doctor not sees more than 10 or 20 patients, I think, in a day.
10 to 12 patients in a day.
yes,
In
sir.
a day. So that way we're at the receiving end from the patient side. You need to spend time with the patient also. Patients are quite demanding nowadays. They are Google search. They are informed, well informed of their disease. Then they are after you, doctor, sir, please explain me what I'm going to do or what I'm having and what is the outcomes. So you are actually liable for those questions. We have to answer to them. We cannot say no. So that these are the main factors what we feel that we are stressed out and burnout happens. But I think at the end of the day, somehow you have to feel, okay, I've done my job for the day. This is the maximum I can do in a day. You need to tell to the patient. Sometimes you have to handle angry patients also, and angry attendants also. It is everywhere. But I think I really enjoy. I think sir also into the field. I think he seems very happy. So I think he's enjoying his work.
Well said. I totally agree with you. You know, if you like your work and then
Yeah.
if you understand the limitations of your work and express those limitations in a very clear manner to the patients and the families, that we are practicing science, we are practicing some evidence. We are not the ultimate guys who will cure the disease. So the expectations are realistic,
Yes, sir.
and then it's much easier to cope up. And there has to be setting the boundaries as well. You know, how far do you move into that emotional space and then burn yourself? And especially in advanced cancers, chronic diseases, where outcomes are universally not good. So one has to be very, very realistic. And you know, one of the points which Dr. Atampreet brought out was that doctors are always supposed to succeed. No, doctors are not. You know, they are not gods, as you very rightly said. And the traditional, you know, the sort of a image of a doctor is that he's always very strong, always in control of the things, and he's going to deliver, he's going to cure, and then he's very resilient. He has an answer to every difficult situation.
Like to
I think,
God.
yeah, like a god. Doctors
Like
do try to find that type of a way out, but we also fail, and that's what we we tell ourselves. And that's what it's a disease process you're dealing with. And diseases don't follow the same pattern in every patient. There is a very famous Israeli physician of the yesteryears, and he said in disease and health, no two individuals are alike.
Oh,
So the
very,
outcomes are not going to be similar.
yes. And that's a golden line, I
Yeah.
think.
Thank you so much, sir. So we're out of time. So it was a pleasure and an honor and a privilege to
Yeah.
talk to both of you.
Thank you
This
so
was really, really very insightful. I learned a lot, and I could
much.
actually feel the enthusiasm you both have and the passion in which you all practice. So, a big namaste to both of you, sir.